Hello, I'm Edward Kondrot from the United States, and it is an honor and a pleasure to be one of the speakers at your wonderful Congress. I want to thank Dr. Pena and all the organizers for inviting me to this Congress. And most of all, I want to thank all of you ophthalmologists out there that are interested in alternative therapies, that are looking at perhaps a new way or a different way to help our patients. These are my disclosures. Insprstar iCell, and I'm the ophthalmic director of the Mercy Ship. And I want to talk to you a little bit more about possibly an opportunity for you to do some charity work on this wonderful ship outside on the coast of Africa. This is my gift to you. This is a copy of my best-selling books available to you at no charge. Just go to kondrotbook.com and you can download this book. And this has much of the material and information that I'm going to be discussing with you. And that is from the opera Turandot, Nessun Dorma, Vincero, and it's all about conquering. And for 22 years, that aria introduced my radio show, Healthy Vision Talk Radio, which is all about helping patients conquer their vision loss. And I also believe that there are many patients and people in third world countries that need our help. And my motto is kind of taking care of the abandoned and the forgotten. And I have a nonprofit organization, the Mission to Cure Blindness. And not only am I taking care of the forgotten and abandoned here in the United States and the world that may be suffering from vision loss, but also people in the third world countries. Many of our patients need help. Many feel abandoned. And I think we all need to be open-minded on effective therapies outside the realm of our traditional ophthalmology. And this is a group of post-op patients in Togo, Africa. Post-op, and you can see the waiting room is right underneath the banyan tree. And that's my website, Mission to Cure Blindness. And they are so grateful for our work. This is the patient celebrating post-operatively. Now, one thing that is necessary when you do mission work, you can't do phacoemulsification with expensive equipment. You need to do a manual procedure. This is called manual small incision cataract surgery. And it's a wonderful procedure. Can be performed in under 10 minutes, and the corneas are crystal clear, so you can get a dense, rock-hard cataract and achieve amazing vision post-operatively. And this is a high-speed video, of the surgical technique. This is a self-sealing incision, so no sutures are needed. And all of this is done manually. We use a Simcoe for aspiration, irrigation and aspiration. There the lens is delivered, and we're putting in an artificial lens in the eye, and that's the end of the case. No sutures. And this is my nonprofit organization, and I want to help you become a humanitarian surgeon. So you can go to www.masterm6.com for more information. I'm also now the surgical eye director on the Mercy Ship, so there's an opportunity. We're recruiting physicians to help perform charity surgery. The Mercy Ship right now is off the coast of Africa. I'd like to focus my talk on two areas. One, homeopathy. The second is microcurrent. Homeopathy is what led me to alternative medicine. So let's begin with homeopathy. At one time in my surgical career, I felt that there wasn't any eye disease that I could not treat surgically. If it was disease, just cut it out and get rid of it. And I was featured on the cover of Ophthalmology Times for my innovative work in developing a sutureless cataract surgery. little did I know that 25 years later, I would be using this same surgical technique on mission work. I was introduced to homeopathy through the Hawaii Ironman. Hawaii Ironman is a grueling event, and I was using many homeopathic remedies to treat various musculoskeletal ailments. And these are 4 homeopathic remedies that I think every athlete should use, and many people are familiar with the first one, Arnica montana. If you haven't used homeopathy, I would definitely get a hold of some Arnica montana. It's just wonderful in terms of treating muscular aches and pains. But homeopathy saved my life, and that caused a major shift in my approach to ophthalmology and chronic disease. I developed severe adult onset asthma, 3 petrochemical pharmaceutical medications. Yeah, they took care of my breathing, but I developed a really bad tremor under this medication, and I had to take a beta blocker to get rid of my tremor when I did surgery, but I was a mess. I had a lot of side effects, and I wanted my asthma to be cured. But the doctors told me that there was no cure for adult onset asthma, no cure, and I decided to explore homeopathy. I know that this wasn't a placebo effect because it was the 3rd remedy that actually cured me of my asthma. The first 2 remedies that I took maybe helped a little bit, but not that much. But the 3rd remedy, it was magical. My asthma was cured. So I began to explore the possibility that maybe homeopathy could help in the treatment of many of my eye patients that I really couldn't offer much hope. So my lungs were normal, no more inhaler after that. So there's a couple principles of homeopathic medicine. One is the law of similars, matching the medicine to the patient. And so we really don't treat just the disease, we treat the whole patient. So if you have 100 people with macular degeneration, maybe each one would need a different homeopathic remedy, because patients with macular degeneration or any eye disease present differently. Some are anxious, some are fearful, and we look at the whole picture. Also, homeopathy believes in a minimal dose. By that, I mean a small medication to actually stimulate the body to heal. And it also follows Hering's law, which believes that the body heals in a certain order. Homeopathy began with the work of Samuel Hahnemann in the 1700s. He was a brilliant German doctor who became disillusioned with medicine at that time, and by investigating quinine in the treatment of malaria, he felt that he was looking at this law of similars and the possibility that it could be quinine could actually not only treat malaria, but the symptoms of malaria, like a high fever and chills. But actually, homeopathy goes back even before that. In the Bible, Moses, Exodus 23:20, and he took the calf which they had made, burnt it in the fire, ground it into powder, and stewed it upon the water, and made the children of Israel drink it. So this is how we make our homeopathic remedies. We grind it, we burn it, we put it in water, and you drink it. So not only did Moses make the homeopathic remedy the right way, but he also selected the right remedy, because gold is the homeopathic remedy for depression and despair. So what does all this have to do with eye disease? Well, believe it or not, in the 1800s in the United States, homeopathy had a rich history with ophthalmology. New York Eye and Ear Hospital was under homeopathic management in 1867. In fact, there was even postgraduate courses in homeopathic ophthalmology being offered. And we had many journals dealing with homeopathy and ophthalmology and eye diseases. And these are some of the standard works on ophthalmology by homeopaths. So I find this very fascinating, and for the last 20 years I've studied homeopathy. I got my degree, and I feel very strongly that homeopathy can be a valuable tool, a very valuable tool to help in the treatment of not only people with chronic disease where we can't offer any hope, but actually a mechanism to help all of our patients. So these are the questions that I'm going to throw out to you. Can homeopathy treat serious pathology? Is there a relationship between the emotional state and eye disease? And can we offer our patients something instead of saying nothing else can be done? We look at the whole person in homeopathy. So this is something I find very fascinating and very rewarding, because when I treat somebody with a chronic disease, often there is an underlying emotional component to it, whether it's grief, fear, anger. And also, we look at a lot of other related physical problems, high blood pressure, arthritis. So we look at treating the whole person. Hering's law is a valuable component of homeopathy. We believe that the body heals from inward, outward. So many times after taking a homeopathic remedy, the disease process will come out and you'll develop a skin rash or a discharge. Also, there's a reverse order. The body heals from the most recent to the oldest symptoms. And a lot of times this has to do with suppression, because in traditional medicine, many times we just suppress the disease. By that, I mean we're pushing the disease deeper into the body. You have a skin rash, you treat it with steroids. Later on, the person develops asthma, the asthma is treated, and then maybe they get heart problems, Alzheimer's, Parkinson's disease. So the body tends to heal in the reverse manner. Also, Hering's law state that the body heals from the top downward. So sometimes a skin problem will begin to cure on the upper part of the body and then move downward. So I'd like to talk about a couple of cases that really, I think, are unbelievable and remarkable. The first one was a 57-year-old radiologist presented to me with a sudden onset of blindness in his left eye. And he had been seen at the university, and they diagnosed a central retinal artery occlusion. But he was from India, and in India, homeopathy is very, very popular. It is said that if you throw a stone into a crowd in India, you'll hit 5 homeopathic doctors. So remember, I mentioned that we just don't treat the disease, we treat the person. He was very loquacious, very talkative. He developed anger very quickly, and his vision was better in a dark room and worse in the light. And he had a history of insulin-dependent diabetes, and indeed, in the left eye, he had bare light perception. There's no afferent pupillary light defect, and the left pupil is slightly larger. And this is the findings in the back of his eye. So one homeopathic remedy, he had a complete return of his vision in 3 days and is doing well 2 years later. And this was unbelievable for me, because I really didn't think that the homeopathic remedy would do anything for his eye problem. I thought, well, maybe it might treat his mental and emotional state. But by golly, he had a complete reversal of the central retinal artery occlusion. Another case was a 78-year-old female, macular degeneration, cataracts, and a balance problem. And she, in addition to the poor vision, she had vertigo, ringing in her ears. A very weak and important aspect of her life was ballroom dancing. And her sexual drive was never very high. So physical exam showed a marked reduction in vision, advanced cataracts in both eyes, and it was myopic degeneration with atrophic changes in her retina. And according to A.B. Norton, in his article, The Homeopathic Treatment of Incipient Senile Cataract, sepia is the #1 remedy to think of in females with advanced cataracts. So I gave her sepia. And 8 months later, a follow-up, she can now read the menu. She claims there was a 70% improvement of her vision. Street signs are clear. And the interesting thing is there's no more dizziness. She's stronger and more confident. No more ringing in her ears. And the vision now had improved to 20/200. But more importantly, she regained many aspects of her function, including her love of ballroom dancing. So remember, homeopathy just doesn't treat the eye and the vision, it treats the person. And I think all of you can recall of maybe seeing someone who could read the bottom line of the eye chart, but had marked visual limitation. Or maybe another person who could barely see the top line on the eye chart, but yet they were able to function without any trouble. So there are many articles published in peer-reviewed journals showing that homeopathy is effective and is definitely scientifically proven. One from the Lancet is evidence for homeopathy reproducible. Also, there was the lead article in the journal Pediatrics, Treatment of Acute Childhood Diarrhea. There was a pilot study dealing with head trauma, and I was involved in the bottom study, the fibromyalgia study at the University of Arizona in 2004. We looked at homeopathy in the treatment of fibromyalgia. So there are no really good published articles on homeopathy in the treatment of eye disease, mainly because it's just so difficult to do any type of controlled study in homeopathy. But I think homeopathy does work, and I really feel that it should be considered part of your practice, especially in those patients with chronic disease and maybe some underlying problems which should be addressed and might be helpful in the overall treatment and cure of their problem. And I am working on a book called Homeopathic Ophthalmology. Hopefully this book will be out by the end of the year. Next, I'd like to talk about microcurrent. I believe in synchronicity, and on my birthday, May 25th, 2014, the New York Times published an article on the body electric, showing how electrical circuits and frequencies are going to become the future of medicine. There's a strong relationship between electrons and disease. Disease is a lack of electrons. We all heard that an alkaline pH is good, and this is an electron-rich environment. Acidic pH is often associated with disease, and this is a deficiency in electrons. And the bottom line is, I think electrons are lacking in any disease state. So if we can increase those electrons in your body, we should be able to help treat disease. Studies have shown that microcurrent improves blood flow, stimulates cellular activity, improves scar tissue, can reduce inflammation, and have a neuroprotective effect. So my goodness, any one of these items will help someone with chronic eye disease. These are some studies, published studies. In particular, the first one, the effects of electrical current on ATP generation, protein synthesis, and membrane transport of the rat skin. And Cheng showed that low levels of electrical current can increase ATP activity and protein synthesis as high as 500%. Unremarkable, just remarkable. The second article showed that microcurrent has a neuroprotective effect, demonstrating that it can be helpful with glaucoma. And the last one, some ocular hypotensive properties of microcurrent. And this is Cheng's article, where he studied the effects of TENS, low-level electrical current on the skin of the rat. The interesting point is, his results indicated that between 50 and 500 microamps will cause an increase in mitochondrial activity. But if you get above 500 microamps, it can actually cause a decrease in activity. And this is a key point, because there are many microcurrent stimulation devices in which there is a high current, not a microamp, a milliamp. A milliamp is 1,000 microamps. And these higher levels may be blocking nervous impulse, but they're not really have the stimulating effect. One area that we're involved with is something called frequency specific, that every tissue has a unique frequency or vibration. So we want to match the frequency of the current to the frequency of the tissue. So there tends to be a harmonization. For example, if you get two tuning forks, they both have the same frequency, they'll be harmonized. So likewise, in the body, we want to send a frequency maybe specific for the retina, specific for the optic nerve, to harmonize that, to kind of stimulate the activity. This became very, very clear for me. I recently passed my level 3 for my ham radio license, and that's my call sign, KM4JQR. any of you that are ham radio operators, email me, and then maybe we can sort of talk on the net, KM4JQR. But whenever you communicate with somebody with the ham radio, you match their frequency, and that becomes the carrier frequency. And then your voice is transmitted over that frequency for communication. So likewise with microcurrent, we're matching the frequency of the tissue, and then we're sending another frequency to kind of activate the tissue to do something, maybe to improve circulation, regeneration, etc. So modern frequency specific utilizes hundreds, if not thousands of frequencies. And we have one frequency for the tissue and another frequency for the pathology. For example, the retina has a frequency of 95 hertz and the macula 137. Hemorrhage has a frequency of 18 and edema 14. So if we wanted to treat edema of the macula, we would send in 14 hertz / 137. And this is the basis of modern frequency specific. And these are some examples of pathologies, common frequencies for pathology. Now, a really interesting frequency is the last one at the bottom, 970, which is the emotional component. And this has actually been a very powerful frequency because it kind of reinforces that every disease has an emotional component. So sometimes we don't really know what's going on with the eye, but we treat the emotional component and there is an improvement of vision. And these are some examples of channel B or tissue frequencies, and you can see they vary, skin, muscle, ligaments, etc., and that's the hertz after each tissue. Now you may be asking, well, how can this be? Well, every tissue has a unique frequency, and this has to do with the density of the tissue, has to do with the carbon, oxygen, nitrogen bonding. It has to do with the hydration. There are many components which determine the frequency. So we combine frequencies. We determine the A or pathological frequency. So when I evaluate a patient, I sit down and try to figure out what is the pathology, and then determine the tissue, and then we match them and we run the frequencies and we evaluate the change. Microcurrent can also be a diagnostic tool. Well, early on when I began treating glaucoma, I was using frequencies for aqueous outflow, for the trabecular meshwork in the optic nerve, and I wasn't getting very good results. But then when I started using some brain frequencies, some central nervous system frequencies, I was getting much better results. So my conclusion was that perhaps glaucoma is a disease of the central nervous system, the autonomic nervous system, not really localized to some specific pathology in the eye. And I think many ophthalmologists now are beginning to feel that way, that glaucoma is a disease of the autonomic nervous system, the central nervous system, not so much a problem with aqueous outflow or aqueous production. Here's an article dealing with microcurrent electroacupuncture, a new approach to neuroprotection in rats with induced glaucoma. Very interesting study. Surgically induced glaucoma was produced. One group was treated with microcurrent, the other without. And the group that had the microcurrent had much less damage to the optic nerve. And the conclusion was that microcurrent should be considered a treatment for glaucoma. This is one dealing with the ocular hypotensive effects with microcurrent. Electroacupuncture on retinal nerve growth factor. We now have identified certain signals or frequencies that can actually stimulate stem cells. Here's electrostimulation to enhance the efficacy of cell transplantation therapies in neurodegenerative retinal disease. Now, this has been amazing for me. I've been looking at focal ERGs before and after microcurrent, and you can see here before and after that there has been definitely a positive shift. So now we're able to immediately evaluate the effectiveness of these frequencies. And I hope to publish this data in the near future, the electroretinographic changes after microcurrent. This is a publication of mine, Improvement of Vision Parameters for participants treated with alternative therapies in a 3-day program. And we looked at nutrition, ozone therapy, syntonic light therapy, and microcurrent. I'm mainly going to focus on microcurrent because I feel that in this 3-day program, it was microcurrent that caused the pronounced changes. I believe that nutrition, ozone therapies can be very beneficial, but usually it's going to take weeks to months before you get to see a significant change in the vision. So these are the ocular conditions that were treated. Dry macular degeneration was the largest group. The second was glaucoma, wet macular degeneration. Also, we looked at macular hole, pucker, wrinkling, Stargardt's disease, ischemic optic nerve disease, diabetic retinopathy, retinitis pigmentosa, etc. And this is the summary of changes in the acuity. And you can see by far the majority of patients did have a significant improvement of their vision. There was also a significant improvement of contrast and marked expansion of the visual field. And I'm going to quickly go through a breakdown. This is the statistics on the dry macular degeneration, wet in glaucoma. And if you notice here that there was a slight increase in some patients with their pressure. 7 patients had an increase in pressure. And the reason for that is in this study, initially if I saw the patient and I felt that they did not have the diagnosis of glaucoma, they had normal visual fields, normal cup to disc ratio, and normal pressures, oftentimes I would ask them to stop their glaucoma medications before the treatment because I felt that the glaucoma was misdiagnosed. So in some of those patients, they had a slight increase in their pressure, which kind of skewed the data. But generally, overall, there seemed to be about a 1 to 5 millimeter lowering of the intraocular pressure. And this is the result in retinitis pigmentosa. This has been a very rewarding disease for me to treat because the majority of the patients I treated had a marked expansion of their visual field. Ischemic optic neuropathy, a very small group, but they also had improvement of their visual fields. Cataracts are probably the most difficult disease that I treat using alternative therapies. The progress is very, very slow. But interestingly, most of the patients do have an improvement of vision, but I think the improvement is due not so much to reversal of the cataracts, but just due to the improvement of the overall function of the eye. Stargardt's disease, very rewarding disease to treat because this is a disease where we really don't offer much hope for these patients. And I did publish an article, which I'll talk about a little later, on the treatment of Stargardt's disease. Macular hole, wrinkling, and pucker, very beneficial. Diabetic retinopathy has been one of the most responsive conditions that I treat. And it makes sense because in diabetic retinopathy, you have edema and swelling, and these are easy conditions to treat using microcurrent compared to scarring and atrophic changes like you see in macular degeneration. This is an article I published, a short review of microcurrent stimulation in the treatment of ocular disease, case presentation of 3 Stargardt degeneration siblings. And this is the overall improvement was marked. And this was a very, very rewarding treatment because these children were all under the age of 17. They were young kids. And all of them had an improvement of their acuity and improvement of their contrast. This is an improvement of their contrast. And changes in capnometric visual fields, a marked change. And this is the results right here. On the left is the pre-measurement. On the right is post. And you can see an expansion of the capnometric visual fields. This is one patient. Second patient, and the third patient. I recently published a chapter in a textbook on alternative therapies in the treatment of chronic eye disease. This was published out of Italy. And in this book, I reviewed the different phases of treatment of the development of not macular degeneration, the phases of development of microcurrent in the treatment of eye disease. The first phase was just using a non-specific microcurrent machine with 4 frequencies, and these were applied in acupuncture meridians around the eye. The second phase was using a transpalpebral approach, and this made patient compliance much better. Patients now were able to self-treat. The first phase was very difficult for patients to isolate each point. The third phase was using the customized frequencies that I mentioned. And instead of using the 4 basic frequencies in phase 1, now we used very specific tissue-based frequencies. And this is an example of our computer-based machine. You can plug it into a computer and you can actually program your own frequencies depending on the pathology. The fourth phase is very interesting. This is looking at specific frequencies or signals to cause a specific cellular and biological effect. There's a company called iCell, and I'm associated with them. They've identified a vascular endothelial growth factor frequency. They've also identified stem cell derivative factor, which is amazing. That means that there is an actual frequency to stimulate the production of stem cells, production and function of stem cells. And the other one is a signal to stimulate Kondrot, and this is an anti-aging protein. So this is very exciting because now we're not using just generic frequencies. We're actually looking at specific signals that can cause a pronounced effect on the cellular and metabolic activity. And this is the company. If you want to have investigate more on them, it's i-cell.com. And this is a patient being administered the microcurrent. We deliver the electrical frequencies through a silver impregnated washcloth that's wrapped in a moist on the surface of the eye, in the back of the eye. Also, you can deliver the microcurrent just by simply holding the gloves, and this is an abdominal treatment for detoxification. And this is a picture here of my clinic in Florida, where people come from all over the world with chronic eye disease. And not only do they receive microcurrent, but they also receive other therapies. So the conclusion is that microcurrent treatment protocols should be considered as part of a treatment program for all ocular disease. And we're still working on the study and isolation of specific frequencies. And now we're exciting because now we have identified specific signals that can now alter critical pharmaceutical pathways. And once again, this is my gift for you. You can go to www.kondrotbook.com. And also, please email me if you have any interest in these alternative therapies, or if you have an interest in perhaps joining me on one of my eye missions in third world countries, please contact me. So I want to thank you so much for the invitation and for the ability to participate in your wonderful conference. Muchas gracias.